Hello, it's Dr. Langford. I wanted to go over the main symptoms I see in patients that are complaining that they have a true bacterial urinary tract infection. So first, let's start with pain with urination, or it's also known as dysuria. It occurs during the act of urinating, not while your bladder's sitting full, but actually as you urinate. Sometimes people can say it feels like cut glass. It could be a mild discomfort. It could be a sharp or burning sensation. But it's anything that is different from your normal pattern. It should not hurt to urinate, and if it does hurt during the act of urination, that can be a sign of a UTI. The second sign can be a frequent and urgent need to urinate. So sometimes in my older ladies that don't really feel that burning and discomfort, the only sign of a UTI is frequency and urgency. So if you're starting to have that and it's an abnormality in your pattern, you need to make sure to see a doctor just to check and make sure you don't have a bacterial infection of the bladder or cystitis. A third reason people complain and feel like they might have a UTI is cloudy or very strong foul smelling urine. So let's be clear. The urine always smells bad, but it shouldn't be a pungent, terrible odor. It might be mildly ammonia-like, but it should not be very strong and pungent. It should be clear like an apple juice. It should not have debris. It should not have blood. It should not look dark and syrupy. So anything that seems very abnormal for your pattern and your hydration level is something you need to see a doctor about as well. You could certainly go to an urgent care. You can go to your primary care and ask them to do a culture, but you also want to make sure that they do sensitivities to make sure of what bacterial infection there is and what antibiotic you would respond to. So, the fourth reason people complain that they might have a UTI is if they have lower abdominal pain and pressure. So sometimes you just might feel like a dull ache or cramping. Some people complain of it like menstrual cramps, and especially if they're uh, postmenopausal, they won't be having menstrual cramp syndrome. So if they feel that discomfort, it might be a sign of a UTI. Um, the fifth reason people come and complain that they might feel like they have a UTI is feeling like they have to urinate right after they just urinated. So they go, they get up, they wipe, they start to walk out of the bathroom, and they feel like they have to go again. If this is new for you and not already been diagnosed as an overactive bladder symptom, you might want to go see a doctor and make sure you don't have a UTI. And I'm going to throw in a sixth little reason here that I think people are diagnosed with UTIs but don't actually know that they have them is when you are a postmenopausal woman and you're going for your yearly checkup. A lot of times they'll do a urine test to make sure that you don't have a urinary tract infection or signs of diabetes or other things that you can tell in the urine. And often you'll actually find that there is bacteria in the urine. Sometimes this is contamination, meaning you just didn't give a good clean specimen. It's very hard for women to get a good clean specimen. You need to catch a midstream urine after wiping three times with three different wipes in the lab, and sometimes that's just difficult for women. So it could be contamination. It could be that you have bacterial colonization, and that's where the bacteria lives there, but doesn't actually cause any symptoms or problems. That's kind of a topic for another discussion. But I want you to know the clear symptoms of a UTI so that you're able to identify it and get treatment sooner than later. So one is pain during urination. Two is frequent and urgent urination. Three is cloudy or dark colored foul smelling urine. Four is lower abdominal pain or pressure, and five is feeling like you have to urinate right after going. And these are all changes in your personal pattern. So if you have these issues, please see your doctor. Make sure that you subscribe and share and like, and hopefully we can keep giving you some more information.